Hello everyone, I'm Dr. Nikita Lad Patel. I'm the Chief IVF Consultant at Apollo Fertility, Navi Mumbai. Today I'm going to talk to you all on PCOD and IVF. So why sometimes a polycystic ovarian disease or a syndrome patient needs an IVF? Basically, what is PCOS? Polycystic ovarian syndrome, or PCOD, we call it. It's synonymous with the same name. Sometimes people are confused. Am I a PCOS? Am I a PCOD? Here, the main cause is anovulation. That is, that when your eggs do not grow, the eggs do not rupture, and that's the reason you do not conceive. So the natural cycle wherein your eggs have to grow from day 2 of your period, your endometrium sheds. From day 7, one of the follicles will start growing. Once the follicle is around 10 on a day 7, day 12 it goes to 13, 14 It'll keep increasing. On day 16 it might rupture. Natural cycle, this is what it happens. But in a PCOS patient, there are many follicles, so they do not rupture on time. That's the main issue with PCOD patients. So the eggs do not rupture. Hence, when the follicle doesn't rupture, the egg is not released, and the egg doesn't release, and hence the chances of conceiving goes down. Because you need an egg and a sperm to be fertilized to get pregnant. So what do we do in a PCOS patient? We have to make sure first we check out the hormones. If any problems, we put them on sometimes 3 months OC pills. Just basic 3 months of OC pills will make sure, they start ovulating. If that doesn't work, we put them on some tablet called letrozole tablet, and we might give them injections if required to grow the eggs. Once the eggs are ready under anesthesia, what do we do first 3 to 4 times? We can even try with simple process called as IUI. So here what we do is we make sure that the egg grows, the egg ruptures, and instead of with natural relation, we make the husband give the sample in the lab. We wash, centrifuge. Good sperms are left inside the uterine cavity instead of vagina. So you should have relation with IUI. That will increase your chance to 15%. So when you have natural relation, you have 7% chances. This goes to 15%. If this doesn't work out in a PCOS patient for about 3 to 4 times, we go ahead with something called as IVF or an ICSI cycle. So here, instead of tablets, so same way. Now, what do we do in that? Instead of starting on a tablet on a day 2 when a patient comes to me, I scan her, do some blood reports, and start them on injections. So I put them on gonadotropin injections, like we get Folisurge. There are more recombinant FSH injections, which we keep giving them for approximately 11 to 12 days. Every day the patient takes, it's like diabetic injections, like a pen, which you self-inject yourself. You don't have to go to a hospital or meet a doctor every day. And you come for a scan on a day 2, day 7, and a day 9, or a day 11 extra scan. So around 4 scans. After that, once the eggs are ready, around 18, 19 So what did I tell you? In a natural cycle, there is only one egg growing. In an IVF cycle, we try to grow as many eggs as possible. And in a PCOS, there are many follicles, more than 10 follicles on each ovary. So you have more than 20 follicles growing together. So in this time, when you have 20 eggs growing, you have to be careful that you do not hyper overstimulate. We have some drug called as the decapeptyl trigger, which makes sure if I retrieve the eggs from this patient, I will get good number of eggs, and she will not have hyperstimulation. So she will not have any. Previously, we used to see a lot of pleural effusion, ascites. Everything has changed with newer drugs. There are no side effects. So what we do is we retrieve the eggs, create the embryos, freeze them all with this decapeptyl trigger, and give the patient about 2 months to get the ovaries back to normal, because instead of 1 egg, we are going to grow about 10 to 15 eggs. Once around those eggs are ready, I retrieve them. We give the body 2 months of break, no medicines, no more injections. And directly after 2 months, 3rd month or the 4th month, I try to prepare the lining of the patient. So that is the endometrium. Once the endometrium is ready, we transfer the embryos, what I had kept. We put a single blastocyst, that is a day 5 embryo. This increases the chances of pregnancy in a PCOD patient. It goes to around 50 to 60% chance. Remember, in PCOS patients, we get so many eggs, but the quality of the oocyte sometimes can be bad. So we try to handle that part. We make sure we put them on a tablet called metformin, put them on some other medicines, and we make sure that the quality of the oocytes in these patients are good. But remember, we have 20 oocytes growing in them, 20 follicles. So even getting 2 or 3 good follicles 2 or 3 good embryos. What we need is a good blastocyst, which will give us a pregnancy. So it doesn't matter. If the semen count is low, then we do not go for an IVF cycle. We go for something called as an ICSI cycle in a PCOS patients. So IVF is done when the semen count is normal. What is the difference between IVF and ICSI? So in IVF, I retrieve the eggs. Same procedure of IVF will go ahead. Only that I leave the oocytes in a petri dish and leave the sperms next to it. The best active sperm will penetrate itself into the ovary and fertilize naturally. But for that, you need to have a good count and a good motility in the semen count. But in an ICSI, when with an PCOS patient, if the husband also have low count or bad motility or not good morphology, we pick up each sperm, inject into the egg and create the embryo. So this is called an ICSI. So many times if you go to an IVF specialist, they will explain you. They'll say, oh, I'm not doing an IVF. I'm going to go ahead and do an ICSI. So you should know the difference between what is IVF, what is an ICSI. And remember, in a PCOS patient, the main thing is you have to reduce weight, because polycystic ovaries, the patients are more obese, they have a higher weight. So first thing is give 3 months, try to lose weight, exercise, and a good diet. So do not eat starchy food, do not eat too much of sugars, do not eat, just try to go for 1 hour good brisk. You need exercise wherein your heart rate should be more than 120, 130, wherein you're sweating. It's not like, some patients tell me, oh, I'm doing yoga, still I'm not losing weight. I went for a walk, but what walk? While going to the market, they just go walking towards that and they call it. So it shouldn't be that way. You should specifically go for a walk, lose weight, eat healthy, or a swim, very good exercise, a complete body. You will make sure that you will lose weight. With that, the ovulation will start processing. Yes, sometimes when in a PCOS patient wherein the AMH is really high, it is very tough to even lose weight for them, because they have resistant PCOS. Resistant means whatever I'm doing, sometimes the eggs do not grow. It's very tough to grow those eggs. But in an IVF cycle, we are not worried, because we give a little bit higher dose of injections, because I know I'm going to retrieve the eggs. In an IUI, I have to be very careful, because I cannot grow more than 2 to 3 eggs. In IVF, I don't care even if 15 eggs grow, because I know I can freeze them. I know I can give a decapeptyl trigger. You do not have any side effects of hyperstimulation. So all this is taken care by us. So you have to know basics that, first thing, if you have been diagnosed with a PCOS, whatever age you are, young, elderly, trying to conceive, even just a teenage, you have to keep a religion of yours is exercise. Every day for an hour, you need to exercise, and you will see the difference. If you do not put on weight, your body is fine, everything looks good, you will make sure that, your PCOS is under control. Because in polycystic ovary, the only fear is pulling on, because of the weight gain, the hormones are in the fat tissues, you do not ovulate. That's the main problem. So we take care of ovulation, and that will handle your pregnancy. Other thing is, like PCOS patient can have diabetes in future. So we make sure, that's the reason we say exercise. So of course, diabetes is pandemic in India. Every alternate person or one person in one family has diabetes. So you have to make sure that you eat right from the beginning. So that's why I always tell my PCOS patients, when I see them at a teenage, nowadays, youngsters are very knowledgeable. They come well read up, they are like, what do I do? I have this condition. They diagnose themselves. So, we go ahead with some blood tests, and you have to be knowing how to handle your condition. Always, a medicine is not the treatment, taking oral contraceptive pills. Remember, first thing is try to lose weight. That will help us out. So exercise, good diet will help you even ovulate. I have so many patients who've lost 10% of their body fat, and they've conceived naturally. They didn't even need an IUI or an IVF. So never give up, think about, sometimes, people think, oh, I'm trying to exercise so much, but I can't lose. I exercise with my partner and she loses, 4 kilos, but I've not even lost 1 kilo. I always tell the PCOS patient that the life is tough for you, but you shouldn't give up. Maybe, she works out and you have to control your diet maybe, or add up another exercise. But 1 hour every day of cardiovascular exercise, not yoga. Yoga is for stretching, toning, relaxing mind. Do yoga, that's good for you 3 times a week, but add up cardiovascular for every. So, I would say join a sport, whichever sport you like. A swimming is the best thing. Doesn't injure any joints, so you can do that. and eat healthy diet. Try to lose 10% of your body fat, and that will make sure that you will ovulate and you will conceive naturally. Chances are higher. If that doesn't work, like I said, the next step is IUI, wherein 3 to 4 cycles, wherein I just stimulate you with oral drugs. With the oral drugs, I will even give you just maybe required 3-4 injections and a trigger to rupture the egg. Once the egg is ruptured, I tell the husband to come down to the lab. He gives a sample, we centrifuge, put in good sperms inside the uterine cavity. That will increase our chance of conceiving. The second step, if that doesn't work in 3 to 4 cycles, go ahead with an IVF ICSI cycle, whatever required. With that, you have a higher chance of conceiving that goes to 60%. So do not think, PCOS, out of the 10 patients in the OPD I see, maybe 3 have PCOS. And it's not necessary that they do not have a child. Most of them have kids. Maybe they have twins. They have more embryos frozen. So, they can come back again for another child. So embryo freezing is always good, because that if the first cycle fails, or you had an abortion or any other cause, or you want a second child, those frozen embryos can be used again. You do not need to stimulate yourself. So remember, we have a lot of options. You have to think about it. Never, just, because you've heard PCOS do not give me child, or there's history of abortions. Why the chances of abortions are higher in PCOS? Because you all lack progesterone. So your gynec will surely put you on progesterone supplements. So you're not going to be having this issue of abortion. Many patients say, oh, my friend who had PCOS, she had 2 abortions, 3 abortions. I'm really scared to go ahead. You do not have to worry. Your luteal phase defect, that is when the progesterone level goes down. So we take care of all of this. So you're going to make sure that you're going to conceive, going to have a healthy child. There should not be any issues because of PCOS. If anybody has any questions, you can put it up, and I'm ready to answer them. Because this is it, I think, because I've had even other chats on PCOS. So anybody has any question? 1 second, there is one. Okay, so there are no questions. So I hope everybody got an answer. What is PCOS and how do we manage it? So hope everybody you have any useful of my talk. And thank you guys. Thank you.